Well, let's see if we can't get some of the main ultrasound questions right, just right off the bat. Have we talked about the fact that it's not piezoelectric? It's reverse piezoelectric. Remember, piezoelectric is when we turn sound into electricity. This is electricity to sound. So we've talked about that. The bone muscle interface the target. It's the deepest of our diathermy friends. Pulse is going to reduce the heat. When we talk about sound energy, that should make sense. It's sound energy. Phonophoresis would be phonophoresis. So photophoresis was the light, the laser. Ionto was the electrical muscle stim, low volt galvanic. And phonophoresis, or sono, like a sonogram, okay, is going to be when we do it with ultrasound. Then finally down here we said the two bad things if you don't move that sound head around is cavitation and shearing. Those are the bad things. So write the word bad, negative, contraindicated. So we've got to keep moving that thing so that we don't cavitate and burn the tissue that's there, or shearing and echo and shear some of the tissue that's there. Now, without looking for just a second, if you heat me up with electricity, are you going to turn it on real slow or zap me so you burn me? So the higher you turn it, the deeper it gets. What was sound? The higher you turn it, less depth. So 1 and 3 megahertz, do you remember the rule? 1 megahertz would get deeper. So here's the whole rule. 1 megahertz is less heat but more depth. 3 megahertz is more heat and less depth. And that's how you select your sound heads. Now, if you'll just bring this down just a little bit, Dr. Laura, let's go from right there. Depth is going to be based on whether or not you want to go into thin or thick skin. So here's a little love note that can help you with the hydrocollator pack. Remember what is the main place that we have thin skin, and it's over the sacrum and the SI joints. That's the biggie, because we're always doing paraspinal things. So just remember that, but it's the extremities, the knees, the ankles, those things have pretty thin skin too. The rest of it is pretty thick. Now let's go to the top and work our way down. It shouldn't take too long. You'll see it goes pretty quick. So ultrasound, one of the key things to remember is that it is part of the diathermy club. So it is high frequency, it's going to get nice and deep, and it's going to treat things. Now, conversion is how it treats you, because it converts electricity to sound. So it's a converter, and it's the only converter. So it's a tried and true rule and a pretty classic question. Now, people that like this say it's thermal, mechanical, chemical, physiologically, neural, even psychological sedation just makes you feel good. The instructors that really love this thing really like it. But what is the primary effect that really, whether it's pulsed or continuous, is the main thing this thing can do? And that's micro massage. So remember, there's always that primary best answer. Now down here, it reminds you, you can use it for almost anything you want, especially the deeper tissues. But it's really important that you remember not to do it over the spinal cord or an open growth plate. Now look, wouldn't this be a double whammy? If they had a laminectomy, that would really do what to the spinal cord? Open it up, lay it open. And if you went over that very quickly, you could burn the patient. So you're supposed to do one side of the paraspinals, actually turn it off, go to the other side, and treat the other side. So they're real fussy about this rule right here. The epiphyseal growth plate, they'll usually try to get you to do it to a 16, 17-year-old sprained ankle. So you'd be on the lookout for that. No ultrasound for that. Even if they say, oh, we're going to pulse it, it's going to take away all the heat, it's acute, it's good for edema. Don't you do it. Now notice it gets pretty close to being close to 20 minutes, because chronic is 5 to 10 minutes minimum. You might get up to 15, 18 minutes, so it gets pretty close, but 3 to 5 minutes is kind of the starting place for acute, so just remember, it's a little less than 20 minutes and they might get fussy about it. And here was your increased frequency, decreased depth, increased heat, the opposite of electricity. That's the, now why would I put GD law there? Any of you that can remember that? That's the Groper-Dreyfus law. I think I said it right, but it's the law on page 2. So we want to know those laws because they show up quite often. Now, the newer books say when we put this in a bucket, we put this in water, and you're going to treat, you're going to treat me, whatever joint you're treating here, under the bucket or in the water, you want to be about a ½ inch away. That's what the newer sources say. For years and years and years, we've gone with 1 inch. So they're allowing us to get closer. Maybe the sound heads are better or more refined. I'm not quite sure for the real reason for this and the benefit for it, but that, if ½ inch and 1 inch are there, I would pick ½ inch. The other thing to remember is water's best. Water is the reason you can conduct it in. That's why the bucket is best. You can even put a bladder, like a water balloon, over somebody, but you'd have to put some coupling here and some coupling agent there. But that would allow you, if I had like an AC separation or maybe a clavicle repair or something that was lumpy bumpy, that could allow you to treat an area that's got irregular surface. So That's called a bladder usually, but it's kind of like a water balloon. So a bucket is best. You can use a bladder over bony surfaces. Make sure you keep moving it so we don't get those bad effects. And the BNR is just the fact that there can be some bad crystals out there that don't convert very well. So the BNR is to make sure that you get the right instrument or a good instrument. Now this box is optional. I don't know that I'd learn it, but I put it there so that you have kind of, first of all, let's look at kind of, sort of some basic questions without memorizing the numbers. It's watt per centimeter square. Sometimes they've asked that. You know, ultrasound is measured in what? Ultrasound treatment. There's thin versus thick skin, and we've kind of talked about what thin is. So you might make use of that, even with the hydroculator pack like we talked about. Acute, there should be a slight warmth. Chronic, there will be an intense heat because you're leaving that on for at least 10 minutes. So probably I'd learn that much, and I'd probably let it go. But if you want to learn it, now I will tell you this. These numbers I used from the Scully textbook, they vary a little bit in every textbook. So again, I don't think I'd bother with those numbers, but it's your call.